Multiple myeloma is a disease that affects many different organ systems, including the bones in 90% of patients and the kidneys in about 60% of myeloma patients over the course of a patient's experience with the disease. Bone protective or bone-directed therapy is a recommended part of all myeloma therapy. There is one small niche or unmet need, and that is for patients who have renal dysfunction defined as a creatinine clearance less than 30, or patients on hemodialysis. The historic standard of care for treating bone disease had been zoledronic acid, which you cannot safely administer in a creatinine clearance less than 30. Recently, Denosumab was approved for bone-directed therapy in multiple myeloma. One of the advantages of Denosumab is that it's not renally cleared and safe for the kidneys. So this study is the first and a much-needed study that addresses that population of patients with multiple myeloma who have a creatinine clearance less than 30, who need bone-directed therapy, but have not yet received it. So this is a single-arm phase 2 study. For this study, we presented an interim analysis of the first 20 of 40 patients. All patients in the study, which includes both newly diagnosed and relapsed refractory myeloma patients, will receive denosumab subcutaneously once monthly for 12 months or doses. We'll be following the serum CTX level to look at the change in that bone turnover biomarker. And also as a secondary endpoint, we're evaluating the safety and adverse events as a result of the drug administration. So far we've enrolled 20 patients. At the time of this analysis, 10 were on track to complete the study as predefined. It's an interesting, looking at the first 20, their arms are balanced between men and women. And there are 6 patients who were on hemodialysis. That's about 30% of the study. The majority of these patients were high risk, so 75% had ISS stage 3 disease. The majority of patients had light chain disease, which goes along with the renal picture that we're seeing. And so in terms of the primary endpoint, we saw a 75% reduction or percent change in the CTX level. But, I think in terms of the practical use, what are the toxicities? We worry about hypocalcemia in the renally impaired receiving these types of agents. We did see hypocalcemia in about 39% of patients. If you look at this in contrast to the phase 3 study comparing zoledronic acid and denosumab is a little bit higher than patients who did have normal renal function. Of the events of hypocalcemia, we saw that 22% were grade 3 or higher. There actually were no grade 4 or 5 events, so it's really grade 3. If you broke it down a little bit further, looking at who was getting hypocalcemia, so I looked at patients who were getting dialysis versus those who just had a creatinine clearance less than 30. 3 out of the 6 patients on hemodialysis did have hypocalcemia. 4 out of the 12 non-dialysis also had hypocalcemia. And then going a step further, because it's one thing to have hypocalcemia, but also, was this something that we did well with, that we controlled, or was it a recurring problem? We did see when we looked at it that 5 out of the 7 patients who had hypocalcemia had multiple events. And I think what this really underscores, we knew this going in, and all patients are given prophylactic doses of calcium and vitamin D. They have to have a normal level of vitamin D and calcium going in. We allow for repletion prior to study initiation to ensure safety and efficacy of giving bone-directed therapy. But it really underscores that this is a population that needs to be studied. Even though we know in theory that denosumab is safe in renal dysfunction, we have to study it, and we need to know how we're giving it to these very vulnerable patients. And so I think we've demonstrated that it can be done, that it's efficacious, but that you absolutely do have to pay attention to hypocalcemia and treat accordingly. Finishing it. So fully accruing it. We continue to recruit patients for this study. And then our hope is that this indication for patients with creatinine clearance less than 30 will be added to the FDA label for this drug, for denosumab.